A very good morning to all of you. We are here again back with the national webinar series that will be hosted by Ishan and Research Center. This month we are doing a webinar in the Department of Sangyaharana on the very burning topic of concept of Sangyaharana. As we all are aware that Sangyaharana is a very basic part of surgery, and we are all aware of the remarkable good and the remarkable achievements that were made in surgery in Ayurveda under the reign of and in the world. We have many references in the Vedas, Samhitas, wherein lots of such surgeries have been elaborated, which in today's world are not only miraculous but outstanding. I would not feel any difference in saying that today's modern medical world is much behind the expertise in surgery that was achieved pre-revolution. In the pursuit for knowledge, Ishan Ayurvedic Medical College this month has taken up the task of coming up with very eminent personalities pan-India who have joined us for this webinar and who will share light regarding this topic with us. We welcome all the students and faculties who have joined us. This webinar series is being conducted under the very able motivation of our chairman, who has always been very passionate about research and Sir has always had this in his mind to project Ayurveda a visionary field. Besides that, I welcome our management, our chairman sir, our directors, our principal, and all the faculty members who have joined us online and offline. Besides that, I am very thankful for all the students and faculties from other colleges who have joined us for this webinar series. To begin the function, I request the faculties to please join us for the lamp lighting and Dhanvantri Vandana.
नमामि धन्वन्तरिमादिदेवं सुरासुरवन्दितपारिपद्मं
without waiting for long, without any further ado, I request our first speaker guest today, Dr. Sukran Sharma, who is working as an assistant professor in the Department of Shariat at Government Ayurvedic Medical College. Sir has done his BMS from Dayanand Ayurvedic College, Punjab, and MS in Ayurveda from SDM College of Ayurveda and Hospital. SDM College of Ayurveda and Hospital. Sir has presented scientific papers in national and international seminars and has been invited as a resource person and Shastra trainer at various seminars and workshops, including those which have been conducted by RAV and CCRAS. Sir is an author of 14 clinical and experimental research articles in national and international journals. He is also an author of 3 textbooks on the topic, including those of surgery. Sir is also a practicing anorectal surgeon at Jammu. I request you, Supran sir, to please begin with your lecture.
Uh, Very good morning to all of you. First of all, I'll request the management and the faculty of the Ishan Ayurvedic Medical College for having me here. Am I audible?
Yes, sir, audible, sir. Yes, sir, audible. Yes, sir, audible.
Okay, thank you.
Yes, sir, clear.
So, thank you so much. I was just verifying whether I'm audible or not. So, the topic for today is concept of Sangyaharana in ancient India. So, to begin with, how do we correlate Sangyaharana in present time? The most common understood transliteration of Sangyaharana, according to many of the practicing Ayurvedic surgeons, is that of anesthesia. But I have another view, not just anesthesia, but I think it is anesthesia plus analgesia. Because whenever we look in modern medicine or contemporary medicine, the anesthetists are not just associated with the making patient unconscious or conscious. They are also associated with providing pain-free to those patients, those who are on chronic, those who are suffering from chronic pain, just like malignancy and other conditions or arthritis, which are not responding to the routine medication. So in today's webinar, I will be laying emphasis on both the historical aspect, how the anesthesia or how the pain-free surgery was done in the ancient India. So to begin with, I would say that the Sangyaharana is the gateway for the development of the Ayurveda as a total healthcare system. The one field which is not being taken up in research nowadays even is that of Sangyaharana. We till date we don't have very good, I'll say, analgesic drugs or anesthetic drugs, at least in our Ayurveda, which can be used to perform surgeries or to make the patient pain free, like those who are suffering from the malignancies. So this is a opportunity for those students who are sitting there to make their interest keen in the subject and to take up the research in their future studies on the subject of the Sangyaharana. So to begin with, Sangyaharana in ancient India, it was called as Bhul Shastra also. Acharya Sushruta, who is regarded as the father of surgery, have performed many surgeries by using, I will say, certain techniques. Those correspond to the anesthesia of the present time. Other than Sushruta Samhita, there are various references of surgeries being performed in a pain-free environment and Ayurveda and also in Vedas. To list a few examples, in Atharva Veda, there are references regarding conduction of the painless labor, and mention of Somrasa is found, which was used before surgery to make patient free from the pain intraoperatively. There is a very famous reference in Bhoj Prabandha 318, where the king Bhoj was where King Bhoj underwent craniotomy, and during this surgery, he was given Sammohana Churna as an anesthetic and Sanjeevani Churna as a reversal of anesthesia. I will not, there is no reference of the contents of the Churna, and Sanjeevani is also found in the Valmiki Ramayana. But the important thing to understand here or to acknowledge is that the surgeons at that time, or I'll say anesthetists at that time, just like today, were inducing the anesthesia like we induce in general anesthesia, and then they reverse that anesthesia using the Sanjeevani Churna. So this is again an area of research, literary research, and then the clinical research which can be performed. In Samhitas, there are references in Charak Samhita, Sharir Sthana, Sutra Sthana, and then in Sushruta Samhita, Sutra Sthana, Chikitsa Sthana, and Uttara Tantra regarding certain techniques and certain ways of performing the anesthesia during the surgery. For example, in Charak Samhita, 8th chapter of Sharir Sthana, there is a shaloka, Vyapagat Garbh Shalyam Tu Striyam Am Garbham, Sura Siddha Arist Madhu Madira Aswanam Asam Anam Agre Samarthyam Payed Garbhkoshta Shuddhyam Ati Vismarnartham Praharshnartham. So here Acharya Sushruta is basically telling about how to relieve and reduce the stress of lady after the Am Garbhashalya, where the fetus has died inside the mother's womb. We have to remove that because it has now become a shalya, and to remove that, the patient or the lady should be given Sura, Sidhu, Arist, and various alcoholic drinks. And these drinks are not just given for the analgesia, they are given for Vismaranarth, where the patient will forget the sensation or the knowledge that she has undergone the surgery, and then Praharshnartham, because she has undergone surgery, and then to elevate her mood, these drugs or these alcoholic beverages were should be administered. In Charak Sutra, there is reference about Sangya Sthapana Dravya. That means the patient who has lost conscious, how to bring that patient into the conscious. I will not comment that these are only used after the anesthesia at that time, but in a patient who has lost conscious, the drugs like Hingu, Katarya, Irimed, Vacha, Chorak, Vyastha, Golomi, Jatila, Palangshka, and Rohinia are used for Sangya Sthapan. And again, there is another reference of the Vedana Sthapan. So we have to understand that these two things are different. Sangya Sthapan is not exactly the Vedana Sthapan. So drugs like Shal, Katfal, Kadam, Padmak, Tumba, Mochras, Shirish, etc. and Ashoka were used as Vedana Sthapani Dravyas to alleviate the pain of the patient. The thing is that we must acknowledge that the anesthesia is not just the Sangyaharana, or Sangyaharana is not just the anesthesia these days, it is also the analgesia, and our ancient acharyas were performing both the functions of making the patient unconscious, then bringing back to the consciousness, and then to alleviate the pain after the surgery. Detailed references or various references can also be found in the Sushrut Samhita. Acharya Sushruta has mentioned in Sutrasthan 17th chapter about the Madhyapan. But the thing here, he is also mentioning that the Madhya should not be given to everyone. Only the patient who is Madhyapaya, that is who is used to take the Madhyapan, has to be given the this alcoholic beverages for the performing surgery. Prak Shastra Karmane Acheshtam Bhojir Aturum Bishak Madhyapayam Payan Madhyam Tikshnam Yo Vedana Asam. And the alcoholic beverage which should be given should be strong enough to make the patient elevated from his or her pain. Then there are another references of analgesia in the our Sushrut Samhita, where Acharya Sushruta, for example, in Shonit Varni Adhyay, before performing Shastrakrit Mokshan, he is telling to do the Svedana of that area in order for the patient to feel less pain. There is the reference that Tasman Shite Nati Ushne Nati Swinne Nati Tapite Yavagum Pratipita Se Shonitam Mokshed Bisham. So the thing of our interest in today's seminar is that Nati Swinne, that the adequate Svedana should be done. Now there are various explanations why this Svedana be done in order to cause the vasodilatation of the vessels so that they may bleed easily and adequately. But if we put some light, or if we take the clue from the modern day physiology, we will understand that this was not just an attempt to cause the sufficient bleeding, but also an attempt to cause the localized anesthesia or localized analgesia by following the gate theory of the pain control. As you all might be knowing that there is a theory which is also called as the counter irritant theory, gate theory of the pain control, which was proposed by the physiologist Ronald Melzack. According to that theory, the pain stimuli are transmitted by the afferent pain fibers and are blocked by the gate mechanisms, which is located at the posterior gray horn of the spinal cord. And if the pain gate is open, the pain is felt, and if the gate is closed, the pain is suppressed. Now we will understand how that gates can be closed by Swedana. So whenever the pain stimulus is applied to any part of the body, beside pain receptors, the receptors of other sensation, for example touch, are also stimulated. So when these impulses reaches the spinal cord through the posterior nerve root, the fibers of touch sensation, which are the posterior column fibers, send collaterals to the neurons of the pain pathway, that is the cells of the marginal nucleus and substantia gelatinosa. Then the impulses of touch sensation passing through these collaterals inhibit the release of glutamate and substance P from the pain fibers. Basically, these two substances are responsible for the causation of the pain. And so these touch sensation will block the glutamate release and the substance P. So whenever we are applying localized heat or Swedana before performing any procedure, basically the touch sensory neurons are activated, and then they will inhibit the release of glutamate and substance P from the pain fiber. So this will ultimately close the gate and the pain transmission is blocked. So I personally feel that this was an attempt of Acharya Sushruta not only to cause the adequate bleeding while performing the Svedana, but also to reduce the pain in the patient who is undergoing the Shastrakrit Rakt Mokshan. Then again in Sushrut Uttar Tantra 46th Adhyay, there is reference that the Sangya Vahasu Nadishu Pihita Swa Anil Adibhi Tamo Obhyapeti Sahasa Sukhdava Vyapokrit. We know that our ancients were very much advanced in mudras and yogas. So nowadays, a few years back, there was one video going viral where one of the doctors was extracting the tooth in a patient painlessly without induction of any localized anesthesia in some college in the Bangalore. What he was basically doing was performing the Jalandhar Bandh in such patients. So by performing of certain yogic kriyas, the nerve impulses to the site of the surgery can be blocked. So here is the same reference where Acharya Sushruta mentions that by Vatadi doshas, the Sangyava nadis undergo blockage or do not transmit the signal, which causes increase in the tamoguna, and person is unable to feel the sukha and dukha. So that is probably how also can explain the action of the Sangyaharan dravyas and the suppression of the nerve roots, localized nerve roots, to perform the surgery, and the patient may not feel the pain. So these were the references, few references from the Samhita. Then again Acharya Bhav Prakasha mentions that the drugs like bhanga, which is there's a shloka in Bhav Prakash, bhanga ka fari tikta grahini pachani lagu tikshna pitla moh mad avgahini vardini, that the bhanga possesses the quality of moha and madkari, which is used in the management of the pain. And also according to Acharya Vagbhata, matulung rasa and madhya can be used as an anesthetic drugs for the eye surgeries. Other concepts are also like that. We all already know that the opium, ahifane, is also used. The morphine, which is a very potent analgesic and also causes sedation, is derived from the ahifane. So if we take up the studies on these, we may attain some good analgesic drugs in Ayurveda also. So there are also other concepts like the various use for local anesthesia, like cocaine extracted from coca. These are some research which I have found from the internet, and morphine for opium. The turas also used. All of are the herbal origin. Very famously now, the cannabis. This is the new hot trend in the herbal medicine. Even abroad, many patients are using this cannabis in the for the mitigation of the chronic pain or severe pain in the malignancies. So cannabis powder has been used as the anesthetic in the abdominal surgery, as mentioned in the Japanese traditional medicine. We know that mantras were used very commonly in our ancient India, and mantra ucharnas before surgery and after surgery was performed in order to give a hypnotic effect on the patient. Jalandhar Bandh, as I told, is used for the tooth extraction as a trigeminal nerve compressor. Then Shanti Vaivika. That means the patient should be consoled before the surgery. This is a kind of a verbal, you can say, anesthesia where we console the patient that nothing will happen. We know that if we directly put a incision or give a prick to the patient will wince in the pain. But if we counsel the patient that nothing is going to happen or very small amount of the pain will happen, the patient is in a much better position to adapt or to accept that procedure. So by these things, we get a clear idea that in ancient India, there was concept very strong. These are the very strong evidence that there was the concept of Sangyaharana, Sangya Sthapana, and Vedana Sthapana by various methodologies. So there are another anesthesia. I will not lay much emphasis on the anesthesia in the modern medicine because everyone knows that it's a very well versed topic, and my further friends will take up this topic. So with this, I'll conclude my session. Thank you.
As Sir rightly emphasized on the podcast, anesthesia and also included and also rightly emphasized highlighted that how and it's a very important topic, and that is why Ishan has so thank you, sir. Thank you so much for joining us and sharing your time to enlighten all the guests and our students. Now, our next guest for today, Dr. Manoj Kumar.
In MSN Institute of Ayurveda, Bhagat Singh Mahila Vishwavidyalaya, Kanpur. Sir is a PhD from. Just a minute. Sir is a PhD in Shalya from GMIMS, Wardha, Maharashtra. Sir did his PhD in the year 2021. Sir is MS in Ayurveda in Shalya from BHU in 2008. Sir did his BAMS from BHU in 2005. Sir has always been a very bright student and a very inspiring teacher as well. Many of his students remember him for years and years and keep repeating about the wonderful knowledge that Sir imparts to his lectures. Sir, besides all these things, Sir has also he's a life member of the National Sushruta Association. He's a member of Board of Studies. And besides that, he's also done courses in yoga from BSU. Besides that, Sir is having a total clinical teaching experience of 14 years. Sir has presented various papers and published book chapters. He has also attended conferences and workshops pan India. Sir has approximately taken up more than 8,500 surgeries, major surgeries in the last 14 years, many of which included cholecystectomy, appendectomy, hernias, and hysterectomies. Besides that, coloraphy, hysterolectomy, and all other anorectal diseases as well. Sir has been awarded by the National Sushruta Association as Sushrut Ratna Award for the year 2022 at Banaras Hindu University. Besides that, Sir has received Surgical Excellence Award by AML Pharmaceuticals in Delhi on Dhanvantari Day in the year 2022. So, this is a very brief introduction of Sir's magnanimity. And without taking more of your time, I request Manoj Sir to please enlighten our audience with his wonderful knowledge.
Thank you so much for my introduction. I consider myself as a student, not as a teacher of surgery. And first of all, I am audible, madam. Hello, hello.
Yes, sir. Audible, sir. Yes, sir. Audible.
I am audible, ma'am.
Yes, sir. Yes, sir. Yes, sir.
Okay, okay, okay. First of all, I am thankful to the Ishan Ayurvedic College and uh, whole of the management team for inviting me to share uh, on this topic. Um, we are basically two faculties who are uh, doing clinical work in VPS Mahila Vishwavidyalaya, which is a leading educational sector, especially in empowering the women with education. And our basically target is to impart the knowledge, especially the surgical skills, to our students, so that they can do many things independent. So this is regarding our motto. We have to create good students so that they can serve the society and enriching Ayurvedic streams. Second slide, please. Hello. Yes. Like our previous speaker has discussed in detail regarding the ancient concepts which are mentioned in various samhitas as well as literatures, out of which the history of anesthesia started with the origin of pain. Everybody understood what is anesthesia. That means aesthesia means pain, anesthesia means no pain. Literally, if we define anesthesia, so it is just like anesthetics are the drugs which are the basically either on topical application or local injections. They cause the reversible loss of sensory perceptions, especially pain, as previously discussed. So this term, what we call as Sangyaharana, uh, which is the modern comparable of the anesthesia, is started with the origin of pain. Like if you are doing the surgical intervention, naturally, once we are basically getting patients in the OPD, and once after the examinations, we have advised you need a surgical intervention. The first and foremost thing which is coming in their minds is the pain. Like once anybody is given the advice like you are having you need surgical intervention, naturally they are thinking about the pain. So this basically the worries of the pain is concerned with this topic what for which we are gathered to here. So this anesthesia started with the origin of pain, and the word intelligentsia is another term which is coming in this context, is now very well known to the fact that the Susrut, which is the who is the father of surgery, established a very well developed surgical science before thousands of years of Christ. And at that time, when the surgery was at the peak of its glory, जैसे कि आप लोग देखते हैं डिफरेंट रेफरेंसेज आर मिलिंग, बहुत सारे आपको रेफरेंस मिलेंगे कि नेक ट्रांसप्लांट से लेकर बहुत सारे संधान कर्म जिनको कहते हैं कि रिकंस्ट्रक्शन सर्जरी, ईयर प्लास्टी, लोबुलोप्लास्टी एंड ऑल, इवन इन द फ्रैक्चर मैनेजमेंट. दैट मीन्स सर्जरी वाज एट दैट टाइम इट्स वाज एट ग्लोरी. और आप इस बात को समझ सकते हैं कि देयर वाज नो very much investigatory tools and there was minimum asset. So it seems that it was very well aware about Sangyaharana, for which we are, without which such developed skill could not be done. That means he has a very much deep knowledge regarding the Sangyaharana. Next, please. And he mentioned basically the first time, which is described in the chapter number 17 in the Sutra Sthan, used वन ऑफ द इम्पोर्टेंट प्राक कर्मस चेष्टम, जिसमें कि मध्य का पहली बार डिस्क्रिप्शन आया है. So before going under surgery, these madhya were not so simple, but has some anesthetic properties to overcome the pain of surgery. So first time madhya का description आया है. Limited Ayurvedic या ancient references मिलते हैं regarding संज्ञाहरण. But one thing which very very concluding, yes, they are having concept of this particular domain regarding surgery, and they mentioned many procedure and drugs to counteract the pain, that is Vedana, and the use of opium was quite common in India, and the another drug which is known as Indian hemp, that is Bhanga, also used in those days. One of the important reference which is very much seen in the Ayurvedic classics or text is a reference to make the patient unconscious is present is Bhoj Prabandh, which is a treatise written about 900 AD during the operations on the brain of King Bhoj, and Sammohan Chund was given for this purpose. Next, please. And the description of reversal, जैसा आपको पता है कि we are using two type of basically, अगर आप एनेस्थीसिया को देखते हैं तो वहाँ दो तरह के एनेस्थीसिया आपको दिखेंगे, जनरली लोकल एनेस्थीसिया और जनरल एनेस्थीसिया. Basic difference between these both type of anesthetic measures or methods is, in cases of local anesthesia, there is loss of sensory perception, especially pain, while in cases of general anesthesia, there is loss of all perceptions, like even patient is even unconscious in such type of. So like once patient in the GA, you need a reversal. कॉन्शियसनेस में वापस लाने के लिए आपको रिवर्सल चाहिए. मीन्स अपार्ट फ्रॉम लोकल वन, दे local anesthetic agent, he is having sound knowledge of general anesthesia also. That's why he has uses the this reversal drug, what we call as संजीवनी, जैसा कि डिस्क्रिप्शन आया है क्लासिक्स में. अगर पढ़ेंगे, the description of reversal from unconsciousness is ever available in Valmiki Ramayana, where Sanjeevani was used to revive the Lakshman who was badly injured in the battles. Like अगर जब एक बार आप GA में कोई भी केस ऑपरेट करते हैं जनरल एनेस्थीसिया में, तो पेशेंट इज अनकॉन्शियस, which is not which entity is not found in the local anesthesia. So you need reversal to recover the patient in cases of GA. मीन्स लोकल के साथ GA का भी इसका मतलब कंसेप्ट उस समय भी डेवलप था, जो कि क्लासिक्स में आया हुआ है. नेक्स्ट प्लीज. एंड अपार्ट फ्रॉम सुश्रुत, चरक हैज आल्सो advocated the anesthetic drug, and Acharya Charak has used it to relieve the pain of labor and extraction of foreign bodies. तो वहां पर एप्रिसिएशन था कि संज्ञाहरण जैसी चीज का यूज करना पड़ेगा, सो दैट द पेशेंट इज हैविंग मिनिमम डिस्कम्फर्ट. Next please. At the same time, he found the concept of nervous system in Ayurveda, which was based on Tridosh theory and Nadi Vigyan, because these anesthetic drugs are basically work on the nerves. So if you are using any herbal drugs or plant-based medicine or herbo-mineral drugs, you must have sound knowledge of nervous system, what are the mode of actions. So in the ancient time, there was concept of Nadi Vigyan that was very much developed, which is really a scope, which is really a matter of research in today's scenario, how these knowledge was highly developed, and they were very well described about the transmitting pathways like Sangyavahi and Manovahi Srotas, which is known as sensory and motor nerves. Now, what are the principles of Sangyaharana or anesthesia? Like beginners should be known to the principles of Sangyaharana and we always keep it in practice for conduct of safe Sangyaharana. सेफ एनेस्थीसिया, सेफ संज्ञाहरण ही हमारा टारगेट है. सर्जरी में पहली चीज होती है सेफ्टी. ये हर बिगिनर स्टूडेंट को समझना पड़ेगा कि हमें दो चीजें बहुत ध्यान रखनी है कि जब भी हम किसी पेशेंट को सर्जिकल प्रोसीजर्स के लिए एडवाइस करते हैं तो हमारा पहला टारगेट है सेफ. सेफ्टी, सेफ्टी इज द फर्स्ट. दैट्स व्हाई you have to optimize your patient, minimize the risk and you will be in the safer zone. एक बार जो पेशेंट आता है चल के आपके अस्पताल में आपसे इलाज कराने और once he is advised for surgery, तो आपको वहां पर सेफ्टी पहले देखनी है. सेफ एनेस्थीसिया, तो सेफ एनेस्थीसिया कैसे हो सकती है, इसके लिए कुछ बेसिक मूलभूत सिद्धांत है. देयर आर बेसिक प्रिंसिपल्स which you have to, a student must remember it to minimize the risk and increase the safety. Like prakriti of patient. Why prakriti of patient, which is Ayurvedic topics, many times it is discussed and it is relevant in even the present scenario. So before anesthesia, every anesthetist should know about the prakriti of an individual. And why it is important? It is important because it affects the dosage of anesthetic agents. जो भी एनेस्थेटिक एजेंट आप यूज करेंगे उसकी जो डोज है वो डिपेंड करेगी कि प्रकृति क्या है पेशेंट की. तो उस चीज को आपको ध्यान में रखना है. फर्स्ट ऑफ ऑल असेस इट. जो हम लाइक प्री एनेस्थेटिक चेकअप में भी ये सब चीजें करते हैं. दूसरा टॉपिक है उसका डाइटेटिक्स. डाइटेटिक्स क्या होना चाहिए? लाइक इट प्लेज अ इम्पॉर्टेंट वैल्यू. आपने देखा होगा बहुत सारी चीजों में, किन चीजों में हमें विदाउट डाइट ऑपरेटिव प्रोसीजर करना है, किसमें डाइट के साथ करना है, नील ओरल का क्या कंसेप्ट, ये सब चीजें. तो इट प्लेज इम्पॉर्टेंट रोल टू नो अबाउट द पेशेंट्स डाइटिक हैबिट्स, their nature of occupation, bowel habits, sleep, history of disease, drug sensitivity and addictions. Drug sensitivity is another very important aspect. Before using any drug, you have to do the drug sensitivity. So taking into consideration. The another one is psychology of the patient. Before taking a patient on table, one must know his psychology. The patient psychology after alters according to the social status, age, sex, caste, religion, and country. And these all should be taken into consideration before planning any type of Sangyaharana or anesthesia. Now, the next thing which is very important is a Purva Karma, pre-operative preparation. What should be the pre-operative preparation? Like preparation of patient. Patient kaise pe, like we are practicing here from last 12 years in this university. Preparation of patient, there are some prerequisites. Like you have to admit the patient night before the planning any anesthesia surgery. Patients, their bowel preparation, pad preparation, tetanus cover, tetanus oxide, like these should be, and the operative area what we are planning should be draped and clean. That we are practicing here like in the form of scrubbing with the betadine scrub. There are many various type of kasai is also available, which you have to practice, like panchvalgal kasai. Like you are going to operate a appendix, you have to prepare that right iliac fossa with the panchvalgal kasai, scrub with this one and drap with the sterilized pad. If it is not available, not ready, you have to use the betadine scrub, cover it so that the microbial load can be minimized, so that surgical site infection can be minimized. The another is preparation of equipments. Naturally, it's very important. You have to sterilize all the equipments what you are going to use in the operative field. Preparation of operation theater, like check the lights, check the oxygen supply, nitrous supply, either anesthetic machines are working or not working, any leakage and all, that should be taken into consideration. The another is preparation of anesthetist himself. That means anesthetist or Sangyaharak, which is very very important in the surgical procedure. दो चीजें मुझे समझ में आती है कि जो सर्जिकल एडवांसमेंट प्रेजेंट सिनेरियो में हुआ है, उसकी दो खास रीजंस हैं. एक तो एनेस्थेटिक ड्रग्स और एनेस्थेटिक एडवांसमेंट, और दूसरी चीज है एंटी माइक्रोबियल एजेंट्स, जिससे देखिएगा आप हर तरह हर फील्ड में आप कुछ भी जनरल सर्जरी, ऑर्थोपेडिक सर्जरी, आई सर्जरी, ईएनटी सर्जरी, प्लास्टिक्स, यूरो, न्यूरो, जो भी है आपको बेटर होते जा रहे हैं बिकॉज advancement of antimicrobial as well as anesthetic agents. So the anesthetist must be very very prepared for taking the patient. The another way is preparation of recovery room. After the procedure like surgery, anesthesia and surgery, patient should be shifted into the recovery room where you have to check all the vitals, the patient's stability, then you have to shift either in the private or general ward. The another thing which is very very important, once we are considering the anesthesia or Sangyaharana, these are the some rules to remember. Like always, these rules should be followed strictly for safe anesthesia and get ready for it. Like once you are using anesthetic drugs or Sangya procedure under Sangyaharana, you must need a tilting table. Okay, tilting table is very very important to achieve the level of anesthesia. Like all of you are aware regarding the spinal anesthesia, which is one of the technique of basically local anesthesia, in which most of the procedures was done either cesarean section or lower abdominal surgery. Even now the people are operating, even still I am operating a gallbladder under spinal anesthesia. Once it is given, you need a tilting table so that the anesthetist must instruct how much table should be tilted so that we can achieve a limited anesthesia wherever we are operating field. So tilting table is mandatory. Either it is working, not working, you have to check it. The another one is patent IV line. Once patient is under procedure, either even you operate in the local anesthesia, like lignocaine. All of you know students are sitting here and they are seeing all these procedures. Even once you are operating a patient under local anesthesia with infiltration anesthesia, you must have IV line, patent IV line. जैसा कि मैंने पहले भी डिस्कस किया कि अगर आपको मान लो कोई ड्रग सेंसिटिविटी हो जाएगी तो ऐसे केसेस में आपको ये पेटेंट IV लाइन पेशेंट को सेव करेगा. सेफ्टी इज द फर्स्ट एंड फॉरमोस्ट रूल इन केसेस ऑफ एनेस्थीसिया एंड सर्जरी. पेटेंट IV लाइन हरदम रखना है सो दैट आपको कोई इमरजेंसी ड्रग देना हो तो आप दे सकें और पेशेंट सेव हो सके. अनदर वन इज सक्शन मशीन. क्योंकि जब भी एनेस्थेटिक पेशेंट एनेस्थीसिया में रहेगा तो पेशेंट इज हैविंग एमेसिस और सेंस ऑफ वॉमिटिंग, दैट इज व्हाट वी कॉल्ड एज नॉजिया. तो ऐसे केसेस में पेशेंट वॉमिट कर सकता है तो पेशेंट एस्पिरेट कर सकता है. तो यू मस्ट हैव सक्शन मशीन इन योर ऑपरेटिंग एरिया. द अनदर वन इज एयरवेज, pharyngeal airways, different size endotracheal tubes or cuff. Like if there is need, you can intubate the patient and save the patient. Another one is oxygen facilities must be there. Once again I am mentioning, if you are operating even in the local anesthesia, you must have oxygen so that if you need any kind of, because hypoxia is a silent killer. Like you are giving a drug, patient is hypoxic, you have to at least add on. So oxygen must be there. Oxygen facilities, emergency drugs, either in the form of whatever the use, either dexamethasone, ठीक है, or hydrocortisone, even adrenaline, ठीक है, whatever the drugs are coming, you have to check it, atropine and all. Emergency drug is always in hand before starting the procedure. Another one, machine checkup before anesthesia, like any kind of leakage, damage, connections, gas availability, etc. And the next thing which is you must remember is a monitoring facility like BP instruments, working BP instruments, stethoscopes, pulse oximeter, cardiac monitors, ventilators, as well as defibrillators. So this must be equipped in your operation theater. And an assistant is always needed, which is at least understood the reflexes of yours. And the next one is another thing was like a disposable syringes, lumbar puncture needles, as well as epidural sets for under which you are planning for an Sangyaharana or anesthesia. So this is the Purv Karm, which is very much discussed in Susur Samhita. And we needs modern gadgets, because without modern gadgets, it is not possible to attempt all these things. क्योंकि जो पहले के रेफरेंसेज हैं जिनमें बेसिकली उनको मॉनिटरिंग का कोई मेजर नहीं है और उसके बहुत ज़्यादा वो भी अवेलेबल नहीं है रेफरेंसेज एज वेल एज उसके टेक्स्ट. Now the another thing which is coming in this context is a pradhan karm or anesthetic management. We will include in this part mainly the anesthesia proper, like spinal anesthesia, epidural anesthesia, general anesthesia और local anesthesia. Basically अगर हम इसको divide करें तो दो मेजर्स में होता है. One is local anesthesia और another one is general anesthesia. इन्हीं दो मेजर्स में हम करेंगे. लोकल एनेस्थीसिया की भी बहुत सारी टेक्निक्स हैं जिनमें कि हम इनको इंक्लूड कर सकते हैं कि आइदर हमें फील्ड ब्लॉक में ऑपरेट करना है, सरफेस एनेस्थीसिया चाहिए, स्पाइनल चाहिए, एपिड्यूरल चाहिए, आईवी एनाल्जेसिया चाहिए, ये सारी चीजें इंक्लूड हो सकती हैं. तो प्रधान कर्म में बेसिकली हम लोग इन्हीं चीजों को इंक्लूड करते हैं. The another is the after the pradhan karm, which is basically very much important in this context. Either patient may be planned under local or general anesthesia, and accordingly the patient can be pre-evaluated. Now the paschat karm is also described, which is post anesthetic management, in which we can include many things from सुश्रुत कंसेप्ट, दैट इज वेदना स्थापक औषधि. जैसा कि प्रीवियस स्पीकर ने भी आपको डिस्कस किया बहुत सारी चीजें कि एनाल्जेसिया इज वन ऑफ द वेरी इंपॉर्टेंट आस्पेक्ट ड्यूरिंग द संज्ञाहरण. तो वी हैव अ प्लेंटी ऑफ वेदना स्थापक ड्रग्स. बहुत सारी वेदना स्थापक ड्रग्स हमारे पास अवेलेबल हैं जिसको कि हम यूज कर सकते हैं. मेनी प्लांट्स आर अवेलेबल विच इज हैविंग pain tolerance capacity. So proper analgesic management in the post operative period should be taken into consideration. Management of asepsis, which is described in Ayurvedic classics in the form of dhupan. जैसे कि अभी आप लोग जैसे देखते हैं तो वहाँ हम लोग sterilization यूज करते हैं. We are having modern concept of sterilization in which using the physical and chemical mode of sterilization, and previously it was dhupan karm. एक आर्थोपेडिक सर्जन है, ही इज यूजिंग जैसा आप लोगों को पता होगा कि आर्थोपेडिक सर्जरी में स्टरलाइजेशन जनरल सर्जरी से 10 टाइम्स ज्यादा चाहिए. सुश्रुत ने भी इसको बहुत डेलिबरेटली डिस्क्राइब किया है. और वन ऑफ द इम्पोर्टेंट फेमस श्लोक आई रिमेम्बर, भग्नम नयो यथा पाकम तत्प्रत्ययेत तथा विसत पक्वमान शिरास्नायु तत्कृच्छेण गच्छति. मीन्स इट्स वेरी डिफिकल्ट टू इरेडिकेट द बोनी इन्फेक्शन, so you need much more sterilization. तो मैं उनका बल्कि एक वीडियो देख रहा था, ही इज यूजिंग धूपन. मतलब हम लोगों को शायद बहुत ज्यादा विश्वास नहीं है, लेकिन उनको है. ही इज फ्रॉम मॉडर्न साइड, वी आर फ्रॉम आयुर्वेदिक साइड, बट देयर इज नीड ऑफ रिसर्च इन दिस टॉपिक. तो धूपन कर्म या एसेप्सिस लाइक स्टरलाइजेशन ऑफ, जो वार्ड की प्रॉपर स्टरलाइजेशन, आपकी ऑपरेशन थिएटर, एसेप्सिस का जो पोस्ट ऑपरेटिव मैनेजमेंट है, इसमें लाइक वार्ड्स एंड प्राइवेट वार्ड एंड दीज जनरल वार्ड शुड बी स्टरलाइज so that the need of antimicrobial agent should be minimized. बहुत ज्यादा जरूरत नहीं अगर आपका एरिया स्टरलाइज रहता है. धूपन का कंसेप्ट भी आया हुआ है बहुत ज्यादा डिटेल में, और उसकी बहुत सारी औषधियां भी डिस्क्राइब्ड हैं, जिनमें कि आपको गूगल से लेकर सर्जरस लेकर सब बहुत सारी चीजें हैं. द अनदर थिंग विच इज वैकृतापहम मीन्स that is normalization of physiology is another post anesthetic management which is described in detail. Fluid and electrolyte management is very, very important, because all of you know in the post operative period patients are deloral. Patient needs proper nutritional fluid as well as physiological fluid. That means patient properly take nourishment as well as electrolyte to avoid any kind of shock, क्योंकि शॉक एक प्रॉब्लम है. इनमें देखेंगे कि कौन सा फ्लूइड जाना चाहिए, किस तरह का प्रोसीजर होना है, कोई मेडिकल कंडीशन तो नहीं है, अकॉर्डिंगली फ्लूइड मैनेजमेंट होना चाहिए. इनपुट आउटपुट चार्ट आपको पता होना चाहिए. अनदर वन इज डाइट मैनेजमेंट, already discussed, and the raksha vidhan, that is general care for infection and shock. So these are the basic concept which is given in Ayurvedic classics and Sushrut Samhita. I have noted down and trying to discuss with all of you. So these are the basic post anesthetic management concept that should be taken into consideration before starting the procedure. Now कुछ जो भी संज्ञाहरण के एक्सपर्ट्स हैं, जिनको एनेस्थेसियोलॉजिस्ट कहते हैं, संज्ञाहरक हैं, उनके लिए कुछ बेसिक चीजें हैं कि 5P 4A इस तरह का कंसेप्ट है. दे मस्ट हैव पंक्चुअल, परफेक्ट, पीसफुल, काम एंड कूल एट वर्किंग आवर्स. डोंट ऐसा एनेस्थेटिस्ट ना हो जो कि बिल्कुल ही कियोस क्रिएट कर दे ना. तो वेरी वेरी पीसफुल होना चाहिए. लाइक आप एक ऑपरेट कर रहे हैं, देयर इज समथिंग bleeding, so he is not shouting and all, he had to manage. Blood pressure is low, he had to manage. Pulse is low, like bradycardia, he had to manage. Because surgeon और anesthetist एक दूसरे के स्ट्रेस को कम करने के लिए होते हैं, बढ़ाने के लिए नहीं होते. And pain taking for patients and prepared for emergency at any time. So these are the 5P concept regarding the anesthesiologist. The another is 4A, that is he must be alert, aware, avoid unnecessary medications, as well as adjusted with OT environments. And there is concept of 3S, like as much as possible, he has to use the single drug as possible. Don't make a cocktail. ठीक है, give single drug if it is possible. समटाइम्स क्या होता है कि लाइक पेशेंट को स्पाइनल लगाया, पार्शियल इफेक्ट रह गया, तो एड ऑन ड्रग शुरू कर देते हैं. तो वेट फॉर सम टाइम, इफ इट इज नॉट क्वाइट इफेक्ट, यू हैव टू रिपीट द स्पाइनल. डोंट एड ऑन another thing unnecessary, otherwise there will be another type of complication. And the procedure should be simple use of simple equipments with simplicity in your attitude to avoid the hazards and complications. And there are some 10 golden rules which is regarding the patients, regarding the anesthesiologist or Sangyaharak. We should take care of the everything seriously before going under anesthesia, because एनेस्थीसिया से ईज भी है और उसके कॉम्प्लिकेशन भी सीरियस कॉम्प्लिकेशन है. तो यू शुड बी वेरी केयरफुल, एंड द माइनर मिस्टेक्स कैन क्रिएट अ मेजर प्रॉब्लम्स ड्यूरिंग द एनेस्थीसिया. देयरफॉर ऑलवेज रिमेंबर द 10 golden rules for safe anesthesia. Next please. Number 1, these 10 golden rules are very, very important. Number one is to assess and prepare the patients adequately. That's why pre-operative, pre-anesthetic checkup is always mandatory once you are going into the proper institutions. Anesthetist has to evaluate you. सर्जन पहले evaluate करेगा, फिर एनेस्थीसिया का बंदा आपको evaluate करेगा. ठीक है. इसके लिए अमेरिकन सोसाइटी ऑफ एनेस्थीसियोलॉजिस्ट ने कुछ क्राइटेरिया बनाए, वो हम डिस्कस करेंगे. तो फर्स्ट ऑफ ऑल असेस एंड प्रिपेयर द पेशेंट्स एडिक्वेटली, स्टार्व देम. पास क्यों, उसको एम्प्टी स्टमक क्यों रहना है, उसके बड़ा रेलिवेंस है. दूसरा है द नेक्स्ट वन, इंड्यूस द पेशेंट ओनली ऑन टिल्टिंग टेबल. टिल्टिंग टेबल मस्ट बी देयर. ऐसा नहीं है कि कोई भी टेबल पे आप काम करें. चेक योर ड्रग्स एंड इक्विपमेंट्स बिफोर स्टार्टिंग द केस. सक्शन मशीन, सक्शन ऑपरेटर्स शुड बी working. Ventilation facility must be there. Next, please. Airways of the patient be clear and patent. An open vein is essential in every case. And monitor the vitals in the form of pulse, BP, very, very clearly, oxygen saturation and all. An assistant familiar to the cricoid pressure and other technique be available in operation theatre. One assistant must be very, very important. So these golden rules, basically purpose of these 10 golden rule is to minimize the risk of the patient. And what should be the pre-operative assessment? Like the aim of pre-operative assessment to assess the risk of surgery and anesthesia, to balance them against the benefit of proposed procedure or operation, and therefore it must be carried out jointly by surgeon and anesthesiologist. Like medical history, ऐसा नहीं है कि like student, those students who are entering into the surgical practice in the coming years, you have to be very, very aware regarding once you are planning any procedure. तो first of all, जो history taking मैंने देखा यहाँ पर, history taken most neglected part students के लिए होता है. They are not willing to take the history. उनको लगता है सब ठीक है, but ऐसा है नहीं. ठीक है. Once you are practicing, going to practice in your hospital, your clinic, your nursing home, and once you are having some experience, you can consider it. It's very, very important. Medical history is very, very important for the patients which are undergoing for this Sangyaharana drugs or surgical procedure. The information regarding present surgical illness, कितने टाइम से आपको परेशानी है, ये जानना जरूरी है. कोई एग्जिस्टिंग मेडिकल कोई कंडीशन है, लाइक पेशेंट डायबिटिक है, हाइपरटेंसिव है, ही इज हैविंग अस्थमा, ही इज हैविंग मिस्थीनिया ग्रेविस और एनी अदर प्रॉब्लम्स, एंड द इनिशियल सिम्टम ऑफ प्रेजेंट सर्जिकल डिजीज एंड डायग्नोस्टिक स्टडीज परफॉर्म. क्या क्या आपने अभी तक प्रोसीजर डायग्नोस्टिक कराया है, वो सारी चीजें आपने देखनी है. नेक्स्ट प्लीज. देन सिस्टमिक एग्जामिनेशंस आर वेरी, वेरी इंपॉर्टेंट फॉर अगेन सेफ एनेस्थीसिया. सेफ्टी के लिए हमें अगेन इंपॉर्टेंट है, लाइक यू हैव टू सीवीएस, इवेल्युएट द सीवीएस. क्या चीजें देखनी है मेनली? एग्जामिन फॉर एनी आरएचडी, दैट इज रूमेटिक हार्ट डिजीज, हाइपरटेंशन और इस्केमिक हार्ट डिजीजेस. ठीक है. कोई चेस्ट पेन की हिस्ट्री रही है, डिज्निया की हिस्ट्री है, उसको कोई लेग में स्वेलिंग है, ठीक है, या आपको इंक्रीज जेबीपी है, टेंडर हिपेटोमेगाली, ये सब चीजें आपको देखनी. Any history of myocardial infarction in previous 6 years, like you are planning for patient for anesthesia, you must taking into account that either patient is having any myocardial infarction history. Then evidence of heart failure like dyspnea, orthopnea, ankle swelling, raised jugular venous pressure, or tender hepatomegaly. These are the symptoms of basically heart failure. ये ऐसा तो कुछ नहीं है पेशेंट, इसलिए आपको असेस करना. एनी फॉर्म ऑफ डिसरिदमिया, रिदम कैसी है, या एक्टोपिक बीट्स, एंजाइना पेक्टोरिस और एनी डिजीज रिलेटेड टू दीज सिम्टम्स रिक्वायर्स कार्डियक कंसल्टेशन. यहाँ पर हम बहुत सारे पेशेंट ऑपरेट करते हैं जनरल सर्जरी के, एंड वी हैव basically list of prerequisite which we are taking into consideration before taking the patient on table. कि लाइक अगर इसमें से हमें कोई भी चीजें दिखती हैं तो वी हैव टू टेक क्लियरेंस फ्रॉम कार्डियोलॉजिस्ट. आप उसकी ईसीजी में कोई चेंजेस दिखते हैं या उसके सिम्टोमेटोलॉजी में कोई चीजें दिखती है, you have to send the patient to cardiologist, and you have to take the clearance from proposed procedure. ये हमें करना है और आप ये देख लो कि कार्डियक साइड से ठीक है या नहीं, so that the again safety will be enhanced, जिसके लिए आपके पास पेशेंट आता है. Another one is respiratory system. Like you must have asked the patient for chronic cough, dyspnea, chest pain and sputum. अगर ये है तो पेशेंट को पहले मेडिकली फिट करिए, देन गो फॉर सर्जिकल प्रोसीजर और एनेस्थेटिक प्रोसीजर. प्रेजेंस ऑफ कोल्ड और राइनोरिया, अगर आप कोई इलेक्टिव प्रोसीजर कर रहे हैं तो पहले आप इसको ऑप्टिमाइज करिए, देन गो फॉर प्रोसीजर. रिसेंट हिस्ट्री ऑफ यूआरटीआई, रेस्पिरेशंस आर ऑब्जर्व फॉर रेट पैटर्न एंड रिदम. कोई ऐसा आप देखते रहिए कि कुछ इस तरह की प्रॉब्लम्स तो नहीं है उसको. एंड एनी ब्रांकोस्पाज्म which is very very important, and in this list it is a contributory cause of death under anesthesia. कोई ब्रांकोस्पाज्म तो नहीं है पेशेंट को, वो देखना है आपने. नेक्स्ट प्लीज. लॉन्ग टर्म, नेक्स्ट प्लीज. These long-term bronchodilator therapy should be continued right up to the operations. Like example, a salbutamol inhalations may be given with pre-medications, and antihistaminics and oral theophylline may be added to pre-medications. Avoid endotracheal intubation if possible. Beta blocker must be used, and the chronic respiratory patients benefit from regional anesthetic techniques if suitable for operation. Like somebody is having chronic respiratory problems, you have to use the regional anesthesia rather than general anesthesia. That will be safe for the patient. And if the general anesthesia must be given, the competitive neuromuscular blockers should be kept to minimum, because smallest interference with the respiratory muscles often lead to severe respiratory failure. And the breath holding test of Sabracaz is important. Now, after the respiratory system examination, before intervening into the anesthesia, you must have the history of central nervous system examination. Next, please. History of any convulsions or fits is always taken into consideration, and fits में आकर under ether. तो ether के अंडर में हो सकता है. तो patient may have epileptic fits, and this is contraindicated for anesthesia. And most epileptic agents enhances the ability of the liver to metabolize the anesthetic agents. Therefore, demand of the drug will increase, and anticonvulsant therapy is continued right up to the time of pre-medication, and restarted as soon as it is practicable orally or intramuscular post-operative. Any history of prolonged headache must be cared. Spine may also be examined for intervertebral spaces, lordosis, kyphosis, and scoliosis. Next, please. GI genitourinary system must be evaluated. Like patient with renal disease may present with difficult anesthetic problems like severe anemia, high plasma potassium ion, prolongation of drug effect. Like कोई patient आप मान लीजिए patient is compromised with urinary system, you have operated it, you have uses the like a drug like what we call as like gentamicin or amikacin, so that will be nephrotoxic. So you have to evaluate it. In these cases, volatile agents should be avoided, and the neuromuscular blockers like veroconium or etraconium can be used. Any history of dysuria, frequency of micturition or incontinence may be inquired, and the normal output of the urine must be taken into accounts. Like in the same fashion, GI system is also included. Next, please. GI system is also evaluated. Note the size of the oral openings. Next, please. Note the size of oral openings. That is important for intubation. Oral opening kitni hai? Like somebody is taking like tobacco product, their oral openings will be very less. And once in cases of emergency, you cannot intubate the patient. So note the size of the oral opening as well as explain the risks to the patient. You are having this problem, and you have to take the high risk consent. Ability to visualize the postpharyngeal structure. Measurement of thyromental disease, like lower, what is the thyromental distance? That is lower border of mandible to thyroid notch. लेस देन 4 फिंगर डिफिकल्ट इंटीग्रेशन. अगर 4 फिंगर से लेस होता है ऐसे केसेस में इंटीग्रेशन डिफिकल्ट है, लाइक इन केसेज ऑफ कॉम्प्लिकेशंस ऑफ स्पाइनल एनेस्थीसिया और respiratory arrest, or like some patient is having convulsion, you have to intubate the patient. So ऐसे केसेस में अगर शार्ट नेक पेशेंट है तो उसमें इंट्यूबेशन डिफिकल्ट होगा. Denture and loose tooth or other artificial teeth or microglacia or macroglacia is also assessed. Temporomandibular diseases should be evaluated. Now, what the special conditions like neuromuscular diseases? In certain myopathies, response to neuromuscular blocker may be decreased or prolonged. In cases of myasthenia gravis, use of neuromuscular blocker is contraindicated. Like somebody is having myasthenia gravis, ठीक है, तो उन केसेस में ये contraindicated है, because normal dosage can cause paralysis more than 48 hours. जो भी हम यूज करेंगे ड्रग, that will be having prolonged effect. Avoid it for safe anesthesia. तो another important thing जो बहुत ज्यादा पढ़ा जाता है, कॉमन है, डायबिटीज मेलाइटस. आजकल बहुत तेजी से लोग डायबिटीज लोगों को हो रहा है. बहुत बड़ी इंडिया तो कैपिटल है, डायबिटीज की हो गई है. तो ऑलवेज टेकन इनटू कंसीडरेशन बिफोर एनेस्थीसिया. In minor surgery, only the patients on insulin or oral therapy requires special management, mainly because of the fasting period surrounding the operation. Anti-diabetic tablets should be stopped 48 hours prior to surgery to reduce the hypoglycemia, because hypoglycemia is more dangerous than hyperglycemia. So stop this drug, and patient on long acting insulin should be switched over to the soluble insulin 12 hours pre-operatively. Frequent needs of blood level should be evaluated. देखना है आपको बीच बीच में कि कितना है. And all diabetic patients need special attention to insulin demand in major surgery, because stress increases insulin requirement partly due to release of catecholamines. And 5% dextrose drip with constant infusion of soluble insulin. That means neutralized drip should be started, and the rate of insulin administration should be based on daily requirement of the patient. So after the pre-operative assessment, there are some assessment scales are advised for the anesthetist, and accordingly you have to assess the patient and explain the prognosis to the patient for making them mentally prepare for any kind of hazards. According to the American Society of Anesthesiologists, condition of patient before operation theater operation, this scale bears some correlation with morbidity and mortality due to operations and anesthesia. कुछ स्केल्स बने हैं ASA1 से लेकर ASA5 तक, जिनको जानना जरूरी है कि किस ASA के अंडर आपका पेशेंट आ रहा है जिसको कि आप एनेस्थीसिया देने जा रहे हैं और जिसका सर्जिकल प्रोसीजर होने जा रहा है. लाइक ASA1 एक ऐसा पेशेंट आता है जो बिल्कुल आपको नॉर्मल है, जिसका ब्लड प्रेशर ठीक है, कोई इसको डायबिटीज नहीं है, ब्लड शुगर नहीं है बढ़ा हुआ, लाइक हाइपरटेंसिव नहीं है, अस्थमेटिक नहीं है, और एनी कोई मेडिकल कंडीशन नहीं, लाइक एब्सोल्युटली नॉर्मल. तो दैट इज कम्स अंडर ASA1. Normal healthy individual or patient is coming under ASA1. Naturally the risk is negligible. The another way is ASA2, in which the patient with mild systemic disease, कोई ऐसा पेशेंट आता है जिसको रेस्पिरेटरी इशू है, COPD है मान लीजिए, या कोई किडनी की प्रॉब्लम है, या उसको कोई हाइपरटेंशन की प्रॉब्लम, तो दे आर कमिंग अंडर ASA2. जब आप देखेंगे जो जहाँ PSC होती है, प्री एनेस्थेटिक चेकअप, अगर आप उनकी सीट पढ़ेंगे तो उसमें लिखा रहेगा पेशेंट इज अंडर ASA1, पेशेंट इज अंडर ASA2, एंड रिस्क एक्सप्लेन्ड. The third one coming with severe systemic disease, limiting normal activity. कोई ऐसा इंडिविजुअल या पेशेंट आता है जिसकी की नॉर्मल एक्टिविटी लिमिटिंग है, like she or he is having some serious systemic problems, so they are coming under ASA 3 ना. Like patient is having CHF, तो सीढ़ी नहीं चढ़ पाता, थोड़ा टहलता है, उसको डिज्निया होने लगता, तो he is having coming under ASA 3. You have to explain the patient, your patient is risky, patient needs a patient need a high risk consent. ASA 4, in which incapacitating systemic disease which is constant threat to life, and the ASA 4, this ASA 5 is not expected to survive 24 hours with or without operation. So that is coming ASA 5. बहुत सारे ओल्ड एज के पेशेंट हैं, हैविंग मल्टीपल सिंड्रोमिक प्रॉब्लम, अस्थमा, डायबिटीज भी है, ब्लड प्रेशर भी बढ़ा हुआ है ना, थायराइड के भी इशू हैं, और मान लीजिए दे आर हैविंग ट्रामेटिक केसेस में है, तो दे आर कमिंग अंडर ASA 5 एंड दे आर हाईली prognosticated. And another category is coming like E, that is emergency operations as an emergency, and patient is in highest risk category again. So this is the assessment scale. जब ये सारी चीजें आप देखेंगे तो आपको ये these are the some parameters by which you can facilitate the patient for safe anesthesia. कहते हैं ना, पहले जितना आप प्रिकॉशंस रखोगे उतने आपके एक्सीडेंट्स कम होंगे या रिस्क कम होंगे. Now, another thing which is very much important before starting the procedure is a pre-medication. Pre-medications is very, very important. And what are the indications of pre-medication? To reduce the anxiety. Patient जब भी प्रोसीजर बेहोशी में जाने वाला है, एनेस्थीसिया में जाने वाला है, तो उसको एंजाइटी रहती है, तो उसके लिए आपको कुछ डिजायर्ड ड्रग्स हैं, एंजियोलिटिक ड्रग्स. प्री मेडिकेशन का पर्पज यहाँ है कि क्या क्या पर्पज है. टू रिड्यूस द एंजाइटी, टू प्रोड्यूस द सिडेशन, टू रिड्यूस द सिक्रीशंस, टू रिलीव द पेन, and to facilitate the smooth induction of anesthesia. That's why pre-medication is very, very needed for safe anesthesia. That's why patient needs one day before admission, one day before, so that he or she will be accommodated with the environment, understood the procedure, going for pre-operative assessment, going for the risk explained and all. So these are the very, very important once we are going through the anesthetic procedure. That's a mandatory. So these few words, trying to introduce this topic to all of you, because this topic is very vast if you are going into the clinical details. But one thing which is just a take home message, what I want to convey, once you are practicing this branch or this branch, you must be very, very sincere, so that the outcome should be very, very best, and you have to serve the society, serve the families, and they are having the good time with you, good remembrance with you, as well as good faith in our system, what we call the Ayurvedic system of medicine. Thank you so much for your patience listening. Any question or any interaction? Sorry. Any question, Dr. Nitika, from audience regarding this talk? If any questions, we welcome. Sorry.
Anybody from our audience who had any questions? Ask.
into consideration, including so I think a lot of things would have been very clear for the first years who are looking forward to learning about all these things, as well as our final year students who are going to study or who are studying about anesthesia in this time being. Any questions from sir? So I think not many of them are having any doubts regarding this. Sir, thank you so much, Manoj sir. Thanks a lot for making such a elaborate description of the topic and making students understand the importance of anesthesia in today's world. Very rightly, sir, put up one very important thing that when you are taking somebody to the anesthetic table, it is very important not just to prepare the patient, but to be prepared yourself. Your machinery must be working, your whatever injectables you require. Moreover, the importance of a patent vein. An additional patent vein is very important because you never know how the course of the surgery or how the course of anesthesia goes. In surgery, it is very important to understand that you have to be very careful about what may go wrong. So not only the knowledge of what all is right is important, but to know what may go wrong and what all precautions you must take is very important. Another very uh, major point that sir touched was about the neuromuscular disorders. Nowadays, neuromuscular disorders are very common, and when you are taking such a patient to your table, you should have very elaborate knowledge about the condition, about the dosage you are going to administer, the anesthetic agents that you are going to take up, and moreover, the kind of anesthesia that you are going to give. And as both our guests talked about the Ayurveda part, Ayurveda had very advanced anesthesia. Descriptions are there, but in the course of history, India has faced many invasions from various sources, and in those invasions, lot of our knowledge, not only of medical importance, but also of other engineering in all other fields, was also lost. For example, when the library, the largest library in Takshashila was burnt down, lot of literature was lost out. So all we had was only references. Moreover, what is in practice is generally written only as an indicator. So probably during those times, anesthesia was being used in such an extent and so vastly that they did not feel the need to mention each and every detail. So they just talked about Samohana Churna. Lot of confusion in this regard is that it is a very common conjunction for everybody to say Ayurveda anesthesia was Madhya. So here we need to understand it was not Madhya. It was alcoholic extracts. Alcoholic extracts of various herbs, of various herbo-mineral origin. So everything is not just when they say madhya, they may be meaning alcoholic extracts. We have Suchi Bharana, references of Suchi Bharana. So probably IV was also being used in those, besides gaseous anesthetics. Even today, your general anesthesia includes inhalation as well as IV anesthesia. So, lot of things that were being practiced are very much a part of our history. Some of the things may not have been left may not have much descriptive evidence available, but nonetheless, it was there. We are conducting researches, and much more research needs to be done, especially in this field, so that we are able to achieve or re-achieve, I would say, that glory in Ayurveda surgery, which was there in the times of Sushma. So with this, I thank you, sir, for your wonderful knowledge session. And on behalf of all our guests and our students, I am very glad that you could find time in your busy schedule. Sir is having a very busy OPD also. So we are very glad you could find time for our students, sir. Thank you so much for joining us, sir. And on behalf of Ishan Ayurvedic Medical College and Research Center, I thank both our guests, Dr. Suprant Sharma and Dr. Manoj Kumar Gupta, who joined us and who imparted their knowledge and shared it with us. Thank you so much, sir. Thank you for joining us.
Thank you, ma'am. Thank you.